My ex-stepdad had a brain tumor, I had a brain tumor, Ray had a brain tumor, all within 100 yards of each other.
An update to a story we first brought you last month. A group of men who grew up near each other in Lonoke County have all been diagnosed with a similar type of rare brain tumor. Our report sparking a Department of Health cancer cluster investigation. Tonight, Fox 16's Stephanie Sharp joining us live in studio after taking a closer look at some of the results. Stephanie.
Well, Kevin, even after our first story aired, we've been contacted by several people who live in the same Lonoke County area that have also been diagnosed with a brain tumor. Today, the Department of Health says the data shows there's a slight uptick in Lonoke County compared to the state average, but not enough to be considered a cancer cluster.
I appreciate the diligence.
Jeremy Gunther at the Arkansas Department of Health learning the result of the cancer cluster investigation.
I'm just glad to find out that it turned out the way it did.
We first met Jeremy in May.
We end up with, the same tumor, same side of the brain.
It was shortly after he, his childhood friend Ray, and others who lived just outside of Austin realized they all had similar rare brain tumors. Jeremy says at least 4 people who lived on the same rural Lonoke County road got the same diagnosis.
The 3 families, 4 brain tumors.
We looked at over 7,000 records.
The Department of Health State Chronic Disease Director says his department followed the guidelines for investigating clusters of chronic diseases.
What we found was we did not find any excess cancers than what is expected or based on the occurrence rate for Lonoke County for malignant cancers.
He says they looked at brain cancer registry data from 2004 to 2015. He says even though the data is slightly higher than the state and national numbers, it's not enough to be considered a cancer cluster. But he says his team will continue to look at cancer data that comes in.
We will be collecting the information moving forward and working with the concerned citizen in making sure that in future if something had to show up.
It was really about finding out if families were okay to be out there.
Jeremy says the numbers don't lie, but it's left him wondering if there may be more, especially with so many tumors in the small area.
There's still something in the back of your mind that says you just can't be that unlucky.
Because of how the data is laid out, the Department of Health looked at Lonoke County as a whole. The researchers weren't able to specifically look at the small area Jeremy lives in.
Certainly fascinating, but just to reiterate, no official cancer cluster has been declared in that specific area of Lonoke County.
At this point in time,
Yeah.
at this date, no cancer cluster right now.
But did they look in that particular area?
And they can't because they can't get the data in that area to look into, so it's very interesting.
And why didn't they go further than 2015? I mean, it looks like they focused just on a narrow window.
Yeah, so the reason why they only looked up until 2015 is because that's how far the data goes back. They don't have 2016, 2017, or the rest of 2018 yet. As soon as they get those numbers from the last previous years, they're going to continue looking at that, and if they do see a spike, it could definitely be considered a cancer cluster. They just have to get that data, and it has to go through the state, it has to go from the hospitals to the state to the CDC back to the state before they can actually look into it.
Wow. I'm sure Jeremy wants answers.
Absolutely. So many people out in that area do.
Yeah.
Sure.
Okay, thank you.